Understanding pain in horses. Recognizing pain in our horse is a very important skill to have. Horses do show signs of when they are in pain, such as behavioral changes. Their demeanor can change. They could show signs of being irritable or aggressive. They could put their ears back when being approached or handled, and they could resist grooming. Social withdrawal, such as isolation from other animals or avoid interaction with humans. Restlessness, shifting weight frequently, repeatedly lying down and getting up. Changes in appetite, such as eating and drinking less or refusing food entirely. A reluctance to move to avoid pain, or resistance to being led. A lack of enthusiasm for activities that they would usually enjoy. Horses can show physical changes such as lameness, changes in posture, a hunched back or abnormal weight shifting, sweating without exertion, particularly in localized areas. We can also check vital signs to see if a horse is in pain, such as heart rate, respiratory rate, and the temperature, so long as a horse does not mind you using a thermometer. It's important to identify low-level pain before it intensifies and becomes harder to treat. Causes of pain, such as a rider or a handler using equipment, tools, or gadgets incorrectly, such as the restraint head collar, incorrect saddle fit, incorrect bridle fit, or a bit that doesn't fit properly, or a rider being too heavy for the horse. Medical issues such as colic, gastric ulcers, dental issues, a tooth having sharp edges or a cracked tooth, injuries from a horse inflicting pain to itself by overreaching, surrounding environment such as a broken fence in a field or a pothole, or another animal biting or kicking. As a horse owner, we must do our best to ensure our horses stay healthy and happy. Knowing how to use equipment, having tack checked, and identifying potential hazard in the horse's pasture can avoid potential causes of pain. The types of pain can be adaptive pain, often referred to as acute pain. It serves a purpose, letting the horse know to protect an injury to promote healing. It's a short-term pain that usually follows an injury with a sudden sharp onset. The pain is usually proportionate to the injury and has a less than 3-week duration. Subacute pain is the recovery phase of acute pain. The adaptive behavior continues and has a 3 to 12-week duration. Maladaptive pain is often referred to as chronic pain. It provides no apparent protective or recuperative benefits. The pain is not proportionate to the actual tissue damage and is very difficult to control. Hyperalgesia is a hyperactivity to a noxious stimuli. An example of this would be a horse's overreaction to having an injection. Allodynia is a hyperactivity to a non-noxious stimuli, not a result of physical damage. There are 3 types of non-noxious stimuli: mechanical, thermal, and tactile. Mechanical is movement across the skin, such as a horse not liking having a rug put on and putting his ears back or possibly biting. Thermal is a mild change in temperature, such as a horse showing signs of arthritis flare-up due to the drop in temperature. Tactile is pain as a result of a light touch. The presence of hyperalgesia and allodynia collectively is known as central sensitization, or the wind-up phenomenon. Horses may mask their discomfort, making it challenging to assess the severity of their pain. The locations of pain, we have somatic pain, associated with bones, ligaments and tendons, visceral pain, associated with gastrointestinal tract and internal organs such as gastric ulcers, neuropathic pain associated with the nervous system, and referred pain associated with the fascial system. An example would be a horse dropping onto the forelimb to avoid weight bearing on a painful hind limb. The horse grimace scale is a way we can assess the overall pain in a horse, using a scale from 0 to 3 to rate each facial action. The facial actions we need to be aware of are the ears being pinned back or held asymmetrically. The eyes can appear angled or squinted. They could have a glassy look, or the horse could have a tense or withdrawn stare. The nostrils may be flared or appear tense. The muzzle may appear tight or drawn, with the chin being more pronounced. Muscles around the eyes and the mouth may show signs of tension or contraction. The head may be held lower than normal or at an unusual angle, showing the horse try to alleviate the pain or discomfort. Typically, it's on a scale from 0 to 3, with 0 being normal, 1 being a mild or moderate change, 2 being a severe change, and 3 being an extreme change. The facial action scores are combined to provide a comprehensive assessment of the horse's overall pain level. Treatments of pain can be medicine prescribed by a vet to alleviate pain and/or reduce swelling. Box rest is also prescribed by vets, aiding recovery by keeping the horse as immobile as possible. There are other non-invasive treatments, such as hydrotherapy, cold hosing to reduce inflammation and swelling. Swimming is another way of aiding recovery. Buoyancy in the water can decrease strain on limbs whilst rehab continues, although not advised for recovery of such things like kissing spines, as the horse will hollow its back while keeping the head above water. Other non-invasive treatments, such as acupuncture, ultrasound therapy, shockwave therapy, or electrostimulation therapy, are available. Horses, as a prey animal, have evolved to mask pain to avoid being easy targets. Having the knowledge to look for subtle signs is very important to keep our horses happy and pain-free. Thank you for listening.